The Loddon Valley Health Alliance is an alliance of 25 members, which are all health agencies. There's some 17 acute hospitals with 5 or 6 community health standalone hospitals across 25% of Victoria. One of the first roles as CIO of the alliance was to look at how could we share our systems, how could we share our staff, our resources, how could we share the cost of doing IT. So the value for our network was to bring a wide area network, go to tender, bring a broadband network to connect all of our members together. Part of the tendering process was to look at, obviously, facility management and how we're going to manage the network. We have over 150 sites that are connected to the network. And whilst it was quite straightforward to go to tender to look at the provision of carriage, we were also looking at the facility management and the ongoing operations management of it. There was a feeling that this was a very complex network and therefore we would have to go with some expertise that would only be provided out of a metropolitan area. What I looked at was how can we use local third-party agents, how can we collaborate with our local providers to provide a whole range of value adds for our community as well as solve the problem of operations management and facilities management. And what I found was that there were a number of local providers that were willing to help provide the operations management and the facilities management processes of our network, but on a local basis. So what came out of that and what we saw out of that was that we had a need to do facilities management and operations management. We thought it was complex. We thought it could only be done by a couple of large national providers, but yet we found on our back door that there were some local providers, and through some collaborative effort and through economic and regional development initiatives, we were able to enhance them to provide the services for our whole region. And we've now moved that way where local providers within the context of our region are providing a whole range of local area network, wide area network and other services that probably 5 years ago would not have been possible. The lessons that we've certainly learned have been that within regional areas there are experts. All the experts to support the technology do exist in regional areas, and particularly in the context of our area. We don't have to go back to a metropolitan or to a city provider. This allows us to be a much larger fish, what I call, in the pond. It enables us to leverage our pricing much better. It enables us to enhance very quickly and be much more adaptable and flexible to the changes that we want because the provider is right alongside working with us almost daily as opposed to remotely. And it enables us to, I think, have a very informal way to the way we do business.